Okay, we've done body tight, we've done face tight. This is the AccuTite. This is the smallest. Again, the technology is the same. The package is just a little bit different. This is the smallest way to deliver this RF. It's designed for discrete areas on the face. This is the lineup. Body tight, face tight pros are going to be the exact same, and then we have the AccuTite. It's the equivalent to a 22 gauge cannula. This is what the lineup looks like. Morpheus is superficial down into the subcutaneous tissue at 8 millimeters. AccuTite's about a centimeter. Face tight, 1 to 2 centimeters. Body tight is all the way down to 6 centimeters. In this spread, I'm going to show you when we get to quantum. Quantum is filling a gap that we have between here and here right now, and it's awesome. This is the size of your AccuTite. I use it all the time for discrete areas of the face. In my world, face tight is kind of the facelift type patient. I'm not trying to put anyone in a box, and I'm not saying it can't be used on younger people. But by and large, most of my patients are 50 and older for face tight. Now, what's weird with my AccuTite, again, not that you can't use it on everyone, those tend to be my younger patients that are in my injector's chair. And we got a little nasolabial fold we don't like, or we got a little early jowling, we're 38, and we don't need much of anything, but we just got a little bit of jowling. That's what I love my AccuTite for, is small, discrete areas of the face like this. Of course, everyone's excited about treating the lower lids with this. I wouldn't start with that. There's some high-priced real estate there. I would get my feet wet with starting with things like the nasolabial fold or the submental area, but it's just an 18-gauge stab. You can put an 18-gauge stab anywhere on the face and be inconsequential for scarring. You treat superficial to the area that you're trying to lift, like here. I'm just tightening above the nasolabial fold. Same technology, same safety built in. Proposed areas on the face from in mode, but I use it all over. I love this one for the banana roll as well. If it doesn't warrant the face tight, I use the AccuTite there frequently, above the knees again. I love, here's a little trick, guys, lateral brow. Gosh, I love it for the lateral brow. Okay, lateral brow. All of you doing injectables, if you're doing Botox, if your patient can appreciate a little lateral brow lift with crow's feet, they're going to love this AccuTite. The way you set it up, you're looking at your patient in primary gaze. That means you and me are looking at each other nose to nose. This is not primary gaze because you're looking up. Alters everything. So you and me got to look at each other nose to nose. Draw a line from a mid-pupil, so mid-pupillary line straight to the hairline. Tail of the brow straight to the hairline, treat in between the two lines with your AccuTite. No tumescent, just numb it up with some lidocaine. Just whatever, 3 or 4 cc's. Balloon it up, treat it, and then Morpheus it. And I usually get about 2 millimeters consistently of lift of the lateral brow. Don't treat all the way across. It's not a brow lift for an old man that has lid skin hanging on his eyes. This is not that. This is for a young female who loves that little bit of lift. 2 millimeters, and it's awesome. It's so awesome. If you treat all the way across, you got people walking around like this. This is an inquisitive look, and this is scary. You got patients walking around scaring people. Can you see? This is when you inappropriately lift all the way across. We're just doing the tail of the brow.